and genetic markers. Advanced cytological techniques can help determine hormone receptor status and genetic mutations that can reveal molecular features that guide precision medicine. For example, in breast cancer, fine needle aspirate of a breast mass can help assess estrogen or progesterone receptor expression, which help determine whether hormonal therapy like tamoxifen is appropriate. Secondly, in lung cancer, fine needle aspirate of a lung nodule or metastatic lymph node for epidermal growth factor receptor mutation testing can help guide targeted therapies. Number 6, screening programs. Diagnostic cytology is integral to large-scale screening programs to identify populations at risk and ensure early medical interventions. For example, in cervical cancer screening, where pap smear can be used and involves collecting exfoliated cells from the cervix using a cytobrush or a spatula. Secondly, in lung cancer screening, whereby sputum cytology can be used to analyze cells shed from the respiratory tract, particularly in smokers or high risk. Thirdly, bladder cancer screening, whereby urine cytology evaluates exfoliated urothelial cells in high-risk patients. Number 2, quick turnaround time. Faster results are obtained compared to tissue biopsies since it involves rapid staining methods like Romanowski staining method. Classical example is Diff-Quick staining technique, and that makes it an ideal for rapid diagnosis. Resampling of specimen in cytology is possible in case of inadequacy or deterioration during storage, unlike in histology, and also very useful for follow-up and monitoring without major discomfort. Number 4, high sensitivity for screening. Cytology is very excellent for early detection of cancers. For example, cervical cancer via pap smear, lung cancer via sputum cytology, and effective for determining or detecting infectious agents like HPV and tuberculosis. Number 5, cost effectiveness. Cytology is more affordable than surgical biopsies and imaging techniques. However, cytology has limited diagnostic accuracy, cannot always distinguish between benign and malignant lesions, and therefore requires histology for confirmation. So some cancers like low-grade tumors may not show definitive malignant features in cytology. Number 2, lack of tissue architecture. Cytology examines individual or small groups of cells, unlike histology, which assesses tissue architecture. So tissue architecture refers to the structural organization of cells within a tissue, including their arrangement, interactions, and spatial relationship. This plays a crucial role in maintaining normal tissue function and is often studied in histology to identify abnormalities like in cancer. So key components of tissue architecture include cellular arrangement, the way cells are organized, for example, epithelial layers or glandular structures. Cell polarity, the orientation of cells within the tissue, which is crucial in epithelial tissues. Extracellular matrix, the support structure that helps maintain tissue integrity. Intercellular junctions, which are connections between cells that help in communication, and adhesions like tight junctions and desmosomes. Tissue organization, the relationship between different cell types within the tissue. And how is tissue architecture important in cancer diagnosis? In cancer, tissue architecture is often disrupted with features like disorganized cell growth, loss of polarity, and invasion into surrounding tissues. Number 2, architectural changes help differentiate between precancerous or dysplastic and malignant tissues. And number 3, the degree of architectural distortion helps determine cancer severity. So limitation number 3, higher false negative rates. Small awkwardly differentiated tumors sometimes do not shed enough cells, leading to misdiagnosis. And also sampling errors, whereby improper technique in fine needle aspirate cytology can lead to inconclusive results. Number 4, limited use for some cancer types. Cytology may not be effective for cancers requiring tissue structure analysis, such as lymphomas and sarcomas. Therefore, it cannot always determine tumor grade, which is important for prognosis and treatment planning.